Basically, when people go to conventional medicine, by and large, with chronic complex disorders, they basically get symptom management. So if their muscles hurt, they'll get a muscle relaxer. If their joints hurt, they get an anti-inflammatory. If, they're depressed, they get an antidepressant. So they're treating what we call the end ultimate symptoms by trying to mask them or make them feel better. And it's logical, right? They're trying to make the person feel better, but it's putting Band-Aids all over the place on someone who's been shot with a machine gun, right? It's just not going to get you there.
This is StRest. I'm Kerstin Lindquist, health coach, author, and Emmy award-winning TV host. I've committed to helping people reduce stress through impressive health science, attainable mindset change, and biblical truth. Let's have a real conversation with zero judgment and endless solutions that you can use. You aren't alone. You can do this. Let me help you reduce stress and make room for rest. Hi, friends. I know so many of you are dealing with so many different levels of how you're feeling. It's not that you have this one chronic condition. It's that there is this underlying feeling of anxiety, of depression, of brain fog. Your body hurts. Your gut isn't feeling right. You can't sleep. Maybe you have certain allergies and reactions to certain foods. And you go to a doctor and they just put Band-Aids on it and they send you from one specialist to another. That's where functional and integrative medicine come in. Today, I am joined by Dr. David Brady. He has over 30 years of experience as an integrative practitioner. He also happens to be the man that I trust the most when it comes to supplements because he is part of Designs for Health, which is where I get all of the supplements that I use and that I recommend to you. He also talks to us about functional testing, things like the gut test and other things that you might get done that go above and beyond what your regular doctor is going to have you do. We dive into all of this. We also talk about the trauma that you had in youth and as a child, how that's impacting your health today. We talk a lot about women's health, and we really give you some of the tools that you can use to feel better in a holistic way, not just putting a Band-Aid on whatever you're feeling. It is a great and science-packed episode of StRest. Let's get in. Dr. Brady, it's really great to have you here. I'm a big fan of everything that you're doing in the functional health space and also with supplements and Designs for Health. I'm a big fan of Designs for Health. I'd love for you to talk a little bit about your 30 plus years and your journey in functional integrative medicine and kind of how it's changed over the years.
Oh, it's definitely changed. I remember back in the day, like you say, 30 years ago, I've been started practice in 1991, so you can do the math. I don't know where all the time went, but back in those days, we were really out there alone. We were like these crazy voices coming out of some tunnel somewhere. And we definitely had people that needed us and were seeking us out, but it was not mainstreamed like it is today. We see a lot of the concepts that we were trying to move forward 30 years ago now being the hot topics, literally, like all over social media, on the news. And those of us who've been around a long time kind of chuckle because a lot of them are put out there as brand new ideas. They're not brand new ideas. Maybe the, things have advanced and some of the science has advanced, but the core principles and the core way that we kind of go at health and wellness and approach it in functional medicine hasn't really changed very much in 30 years, but the details have.
What is it? So when I, as a health coach, talk to somebody and say, it's probably a good idea to find a really good functional or integrative medicine practitioner, what am I saying? What is functional? What is integrative? What does it mean?
Yeah, well, it depends who you talk to, right? And I feel your, I think, a little bit of pain on how you even describe what we do. Because, I'm on airplanes a lot going to speak at conferences and stuff. And people see my screen open. I'm working on slides or something. So they figure out, that this guy's a doctor or something. They start asking me questions and, or just in general, they find out I'm a doctor. Well, what kind of doctor are you, right? What kind of medicine do you do? And if you say functional medicine, nowadays, sometimes you get, wow, I can't believe it. I love functional medicine. And they know about it, like 30 years ago, nobody knew about it, right? But by and large, they really don't know what it means, right? It's a very confusing thing to them. And so I've tried them all, right? To see how people react to them. Integrative medicine, they still don't get that either. But I think that's a little easier to kind of explain in sort of an elevator pitch. Say that we integrate together the best of conventional medicine as you know it with more traditional forms of medicine and healthcare, which involve a lot of lifestyle changes and stress management and diet, the use of natural things like herbs and nutrients and things like that. And we integrate it all together in a very modern construct or a very science based way. And they kind of get that, but it still takes a while. It's not like saying, oh, I'm an orthopedist, right? Or I'm a family practitioner. They get that pretty quickly. But they're, what does it mean? Again, an interesting question because those terms have by and large been really kind of usurped and bastardized to some degree. Like functional medicine is a very specific method of going about managing a patient. There's a specific what we call matrix of care on how we evaluate people and how we treat people and the way we assess them, what we prioritize and what we don't. But a lot of people have sort of wanted to latch on to this functional medicine term, and they call just about anything you can imagine functional medicine. And again, it's something we kind of chuckle at. Sometimes we cry at because things get called functional medicine and they're nowhere near functional medicine.
Yeah, absolutely. What are some of the okay, so what are some of your cornerstones then when you're working with somebody as opposed to when they go to their GP or they just go to their doctor? Or these days, I mean, it's so specialized. You have to have a cardiologist, you also have to have a gut doctor, you also have to have a this doctor. How is functional medicine different? What are some of your cornerstones?
Well, if you really have a well trained functional medicine clinician, they're often physicians, but they don't have to be a physician. There's other kinds of healthcare practitioners who try to practice within the functional medicine paradigm or approach. The basic tenet of it is, first of all, it's not a treat a symptom type of paradigm. It really is what we consider a systems biology approach to usually very chronic, complicated, long term, ongoing health challenges that people have. They're usually not easy ones where someone would have already taken care of it, right? If it's a 6 minute office visit with your, GP because you have a mild upper respiratory infection or something, then, you don't need a functional medicine doctor for that, right? So we by and large see people with kind of complicated stuff. So what we really emphasize is trying to climb upstream. And a real common thing you'll see people throwing around, especially in social media now, is root cause medicine, right? Well, what does that mean? We're trying to get backwards in time almost to when this all started and why it started. So what were the antecedents and then the triggers and then the perpetuators of the problem that sustain it and keep it in sort of a locked loop, feed forward? And how can we break that, right? So we're always trying to climb upstream on why is this happening? What is going on? And that we appreciate that generally your symptoms are a consequence of abnormal function of something. So that's where functional medicine comes from. It's not, do differential diagnosis, name the disease, give the drug for the disease, or give the agent for the disease, or give the procedure for the disease. It's really not about that. It's trying to understand the patient as a unique individual and everything that led up to them getting sick or having a problem, and then what's sustaining that, and how can we somehow improve function of critical core systems in the body and core metabolism often in the body to try to rebuild them to a healthier place. And sometimes it also involves trying to find out what, if we often think of the disease as sort of a chair or a stool with multiple legs, right? And the legs that hold this whole thing up are these different factors of the disorder. And if we can find one and pull it out of the picture, it's like pulling a leg out of the stool, the whole thing crumbles, right?
Right.
So we're trying to unlock it by climbing upstream and working in any way we need to pull that leg out from under the stool and restore them. So that could be, and it often involves all of these things, changing their lifestyle, figure out what kind of stress they're under, trying to get their life, a little bit more in a healthy, less stressful state, trying to improve their diet, trying to get them moving. Again, a lot of times chronically ill people, because of the way they feel, they're just not moving anymore. They've given up. They're not moving their body through space. I don't even mean they're not exercising or working out. I mean, they're hardly moving. right? And that's just not conducive to health. And then we have to look at their diet, obviously. And then we look at various strategic therapeutic interventions. And that could be with sort of treatment level dosing of key nutrients. It could be vitamins, it could be minerals, it could be amino acids, it could be what we would call nutraceutical, some kind of natural compound that's not a vitamin, it's not a mineral, it's not an amino acid, it's some other thing, like a phospholipid or something like that. It could be a botanical, it could be a active ingredient from a plant or from an herb, sort of nature's drugs, if you will. Or it could be a drug, it could be a pharmaceutical, it could be a procedure, it could be a medical device, it could be a laser, it could be EMF or some kind of magnetism, it could be red light, it could be a million things. These days there's so many great options. Even in some cases it's regenerative things, it's stem cells, it's exosomes, it's peptides. But the key is to try to figure out what's going on and map it along this functional medicine matrix. And then I think where experience comes in is to figure out how to prioritize, right? How to triage through all of those things and get the best return for your effort, right? So how do you attack it and how do you go at it? If you go after everything and if you chase every symptom, you don't get where you need to go. And basically, when people go to conventional medicine, by and large, with chronic complex disorders, the things that I'm talking about, they basically get symptom management or attempts at symptom management. So if their muscles hurt, they'll get a muscle relaxer. If their joints hurt, they get an anti-inflammatory. If they're depressed, they get an antidepressant. So they're treating what we call the end ultimate symptoms by trying to mask them or make them feel better. And I mean, it's logical, right? They're trying to make the person feel better. They're trying to do something good.
Right.
But it's, putting Band-Aids all over the place on someone who's been shot with a machine gun, right? It's just not going to get you there. So, and not that functional medicine is perfect. I mean, we are challenged by a lot of really complex chronic disorders that are not easy to treat no matter what you do. But that's what we attempt to do. And we're usually fairly successful at it, although not universally so, just like everything else.
Everybody's human.
Yep.
And everything's a practice, and we're constantly learning.
Yep.
And I think that a lot of people listening go to all the doctors and the doctor to put a Band-Aid on this and a Band-Aid on this and a Band-Aid on this. And even they know, having no medical background, that there's a root cause that's creating all of this. So if only all doctors could be practicing in this functional space to try and get to the root cause. And I think that is what's so frustrating, because we're so taught, and rightfully so, to trust doctors because they're lifesavers. But sometimes you need more, especially with a complex chronic condition.
Yeah, and that's where the difference is. I think, the classic Western medical construct, allopathic medical construct in the US medical system is probably the gold standard of that approach, has really become very, in my opinion, over specialized, right? You have a lot of these highly trained doctors who've spent a long time learning every single nuance of a very narrow band of information or a system of the body or an organ of the body. And you need that in serious acute diseases, particularly rare diseases where someone has to diagnose something that doesn't walk in every day. You need people with super, super high level of specialization. And certainly when it comes to surgery and procedures and things like that, which just take a lot of time to learn that skill to do it effectively and safely. But it's created another problem in that, those doctors tend to look at the person in front of them as their special system, right? And they have a hard time looking outside of that. And when they do, the answer is to refer them to another specialist for the other system they're concerned about, right? So now you got someone seeing a gastroenterologist, you got someone seeing a hepatologist and a neurologist and a rheumatologist. Very often they're not talking to each other. They're too busy to get on the phone with each other or have some kind of interactive, kind of meeting about someone's chronic case. So you get very disjointed care, very disarticulated care. Everyone's trying to do something. So you end up with people on 12 medications. It's just a nightmare. I have people that come in all the time. They're literally on medications in the teens, at least, right? Somewhere in the teens, right? And when you pull it apart, often they're on 9 medications for specific reasons, and they're on another 6 to counteract side effects of the first 9, right? At some point, it becomes ridiculous, right? And no one's pulling it all apart. And when you talk about drug-drug interactions, we don't even know the drug-drug interactions between 14 different medications at one time. There's no database to go to figure that out. That's a guessing game. So, and they're stressed out. They're stressed out by the medical
Yes.
system. I mean, I go through this even with extended family members, particularly older folks, where to see them even try to interact with the modern American medical system is disheartening. I mean, how do you tell someone in their 70s or 80s or 90s, go to the portal and download the new forms, right? Or go get your lab work in the portal. They don't know a portal from a
And all the
spaceship.
portals are different, and all the
They're all
portals have
different.
different websites, and no.
Try to call a practice these days. Try to call
Yeah.
a medical practice, particularly a specialist practice. Try to call one and talk to a human. And if you do, they don't have the answers for you. And then if you finally do get an appointment, usually in most areas around the United States now for specialists, you're waiting months for an
Hmm.
appointment unless it's an absolute emergency and you're routing through an emergency room in a hospital or something or an acute care facility. And then generally when you do get to your appointment, you often see a physician extender. You see a PA, you see an APRN, you see someone on their staff, and they can be great providers. This is not
Hmm.
a
A
negative
dig on
statement
them.
about that, but you're trying to get an appointment with a highly specialized rheumatologist, and you're not seeing that highly specialized rheumatologist after you wait for 6 months. You're seeing their
Yeah.
PA or an APRN. Now, they may be really good, and maybe they're even better. And maybe I can certainly see how they're valuable in like ongoing management of a patient. But the initial assessment and workup, you would hope that you're seeing this highly trained specialist, right?
That you've waited for.
That you waited for, and you are generally not.
Yeah.
It's
Oh, that's
frustrating.
funny because like a note on that, I do often say, listen, sometimes the NP is going to actually have the newer research
Yeah,
than the
and you know
doctor
what? They
does.
might spend more time with you and have better
Yeah,
bedside manner, and you
it's
might get
true.
a better result. I'm not
Yeah,
challenging that, but it
no,
is
not
what
at
it
all.
is, right?
Think about it this way. Those of you who ever watched the shows like Grey's Anatomy or
Yeah.
ER, it's the way that the arc of the show goes is somebody comes in, there's a problem, they identify it, they have a surgery or they give them a pill and it's fixed. And so we are trained to believe that's what it is. You never once in those shows do they say, okay, well, let's do some testing. Let's do some gut testing and see what your genes are. And let's see how your mitochondria are reacting to see what the holistic approach is to what's going on. But really, that's what we need these days.
Yeah, because the kind of things on the story arc of those kind of fantasy shows, it's always some dramatic, rare thing or some crazy thing that needs to be diagnosed by house or something like that. And that's just not reality. I mean, what we're dealing with most people are common things that we see all the time. And now probably, they usually do studies like this every couple of years, but basically what ambulatory care physicians are seeing, particularly family practitioner, general practitioners, even internal medicine docs, what they're seeing in their practice, like 85 to 90% of patient cases, is not what they spent their medical education learning about. They spent their medical education learning about all these discrete diseases and the treatments and all of that. And what they get in their door is a gobbledygook chronic disease, myriad of symptoms, conglomeration of stuff. It's not finely diagnosed one disease, it's a whole bunch of stuff rolled together because these people have chronic complex disease. And at least up until now, the modern Western medical education does not prepare them in any way, shape, or form for complex chronic disease of our
So,
aging
okay,
population.
what are you seeing more than talk to me about some of these chronic conditions and if you have an opinion on why it's what we're seeing the most?
Yeah, if I had to, and you can go into the medical literature and look at the most common presenting complaints to ambulatory care providers every year, and they haven't changed a whole lot, at least in the last decade or so. And if you take some nuts and bolts stuff off the table, like acute upper respiratory tract infections, right? The sniffles or a cold or something like that, you're left with basically profound, ongoing, unexplained fatigue.
Mm.
You're left with body-wide achiness and pain and stiffness, brain fog, and unexplained weight gain. inability to lose weight or have good body composition, and mood disorders, right? Depression, anxiety, insomnia. Those are pretty much the big ones. And GI issues, gut issues, constipation, diarrhea, things that will tend to get diagnosed probably as irritable bowel syndrome or IBS, or now the new term disorders of gut brain interaction, right? Or DG.
So why? Why do you think? I mean, all of those things that you're saying really resonate with, I think, people listening to this because it's a lot of the common complaints and things that people are looking for answers on social media, in podcast, in their doctors, with their health coaches. Do you have an idea of why you think we're seeing that common theme of all of those? Is there something that's
Yeah.
going on in our world?
Yeah. And I don't think it's my opinion. I think it's pretty plain and pretty factual. Poison food. The food industry has absolutely obliterated our food supply. It's no longer a natural source of nutrition and sustenance. It's all doctored and monkeyed with to some degree. Even if you stay along the outside edge of the supermarket and buy what you
Right.
think are whole foods, they're genetically modified. They're sprayed with atrazine. You can go right on down the list, right? They're not natural food. And the US is the absolute worst with this. And we have the worst health outcomes, and we have the most unhealthy population, the most overweight population, the sickest population. Even other Western industrialized countries like, and, European continent, the food is much better. They've not let their food isn't pristine anymore, but their food is controlled a lot better than the US, and their food is much better. So even Americans who go traveling over there for a couple of weeks go, I just feel different. I feel better. I
Yeah.
ate more than I do at home, and I ate bread, and I ate pizza, and
Yep.
I drank wine, and I lost weight, right?
Yeah.
I mean, this isn't a
I
mystery. Our
I
food,
can't eat cheese at home, but I can eat
no,
cheese when I'm in France,
exactly.
right? Those things.
And that's all, the curtains being pulled back from the wizard here, right? With a
Mhm.
lot of the modern things going on, particularly with, Food Babe and all these people exposing this stuff and getting a voice. We have American food companies that have poison versions of the same food for the US and a cleaner version for Europe or for Canada even. Why? Why, where is the government getting control of that? I don't want to get into that because we know the answer to that. It's a rigged game, right?
Right.
But our food is poison. Our environment's not in great shape. We have fine particulate matter in the air, these PM 2.5s and less. These are just very, very small toxic air pollutants that get in through our lungs and then get into our bloodstream and cause a lot of inflammation, cause a lot of autoimmune phenomena, and really muck up the gears, so to speak. And then you have microplastics all over. You have herbicides, pesticides. You've got so many endocrine disruptors. So the environmental toxic load in the exposome, as they call it, to people is massive, and it's changed so much, certainly in 100 years. It's a testament to the body's really robust and incredible and dynamic detoxification systems and ability that we're even alive through this type of change. Because compared to an evolutionary change, this is like, getting hit by a truck. I mean, the
Yeah.
environment's different, the food's different, the culture is different, right? So we're under tremendous stress. I mean, modern life is very, very stressful, even for people who don't think they're under stress. And then you have people all through the spectrum to entirely overwhelmed and in a nervous breakdown. But even people who think they're kind of okay, when you dig under the surface, they're very stressed. We're all stressed. I mean, look at this. This thing never stops. It's right here, right?
That's one of the biggest problems right
That's
there.
the
Is
biggest
that just
the biggest
it keeps
problem.
us we don't have brain breaks.
We
There's no
never
brain
turn
breaks
it
anymore.
off. We're always getting sensory bombardment, right?
Yeah.
Even if you turn the phone off to not get the bombardment while you're sleeping, most people have it right next to them, and it's bombarding them with energy and EMF, right? So, that's an issue. It's never dark, it's never quiet. We live in an entirely new false environment and existence than we did for our entire evolutionary history up till 50 years ago, certainly up till 100 years ago. And it's kind of amazing that we're still as healthy as we are and we haven't perished. And I think all of those problems that I just mentioned are problems of the Western industrialized world, but they are at their pinnacle as of problems in the United States for various reasons of, our government not doing its job, honestly, in the health realm, in protecting public health. And, many of the things we talked about that are the most common things to present to doctors in the US, this pervasive pain and joint inflammation, degenerative processes of the body and autoimmunity, gut issues, brain fog, depression, anxiety, hypervigilance, insomnia. If you go to the underdeveloped third world, you don't see it at all. You see other things. You still see infectious disease, and you still see parasites, and you still see all these things that we've kind of got on top of, but we've created a whole new bunch of health problems. And you know what? They're harder to treat.
Yeah. Yeah. My family and I went for 3.5 months to serve in Mexico at a Christian medical clinic. And that was one of my big
It would be
ahas
an
as
aha
well.
moment, right? Yeah.
It was. I mean, very third world, very undertreated, lots of poverty. Clean water was not a thing unless you walked and you went and got it. And yet they were not stressed out. And we were not seeing the level of the things that you were talking about down there in this medical clinic. It was all kind of acute
Yep.
issues.
Yep. And, the further you go away from the Western world, like Mexico's right next to us,
I
right?
know. Yeah.
But if you go into the Amazon or if you go into Central Africa or something like that, and you really get to indigenous populations who really live much closer to the way we did, a long time ago, they have their problems and they have their challenges, but they are entirely different ones than us.
So, what role is stress playing in these chronic conditions? I know you touched on it a little bit, but do dig deeper into that. When I go to a doctor and I have something going on, what should the doctor talk to me about when it comes to stress?
Well, first of all, I think I was in academic medicine for, 25 years, and I trained a lot of students, a lot of medical students, a lot of students in various other health disciplines and professions, all the way up to residency. We tried to make this not the case, and I certainly did, but it's a bit of a lost art for doctors to actually take the time and have the skills to do a good medical history, to actually find out a little bit about the person. Where did they come from? What kind of environment did they grow up in? Because the level of stress and the level of perceived security or perceived threat you are under when you are young, when your nervous system is still developing and neuroplastic, and you're learning how to titrate or generate your set point for alarm, right? For threat, your threat surveillance and your threat reactivity level. It's a dial that's set at a bias depending on your very early life experience. And that's why we see people with known, adverse childhood events, I mean, the obvious, over the top example of this would be sexual abuse, physical abuse, verbal abuse, but it doesn't always have to be at that level. It could be moving all the time. It could be divorce of parents at critical ages. It could be one parent with a substance abuse issue and the problems that creates. It could be moving to a new country where you don't speak the language, right? It could be a lot of different things. But those kind of things can really have a long, sticky imprint in the nervous system. And it can create a very stressful sympathetic bias, like a hypervigilance, we call it, in the nervous system. And I see this associated with many, many of the chronic disorders that we're talking about. From those histories, clearly, they're not the only thing involved, but they make a subject way more susceptible to other triggers that can create sort of this ball of chronic disease. So like adverse childhood events, early life stress, particularly in females. And, I know it's not popular to be able to say different things in the different genders, but biologically they're
Go for
different.
it.
Yeah. So,
Yeah.
I mean, our brains are different. Our neurotransmitters react differently particularly to stress and particularly to early life stress. Females that have been in that environment of not feeling safe, feeling under threat, not feeling secure, not feeling loved, it could be any or all of those things, right? End up in a bias of the nervous system that is in very similar metabolically and physiologically to a classic post-traumatic stress disorder, but on some level in an ongoing basis. And it makes them much more susceptible to things like anxiety, depression, insomnia, never going into deep restorative sleep. They're very susceptible to post-viral syndromes. So tend to be the people who develop chronic fatigue syndrome, ME. They tend to be the people that develop fibromyalgia. They are more likely to be the people who got long haul COVID after
Hmm.
exposure to SARS-CoV-2. And they're much more likely to be diagnosed with IBS, irritable bowel syndrome, or some level of what they used to call functional gut disorders, DGBIs, disorders of gut brain interaction. So it's a complicated mess, and unless the doctor even goes back that far, they'll never know really much about you. You can walk in, seem to really have your stuff together, seem to be in a high, even, social status. Everything is great. You got a great spouse, you got good kids, everything looks fine. You start asking them about their childhood, it was a train wreck, right? And they're carrying that stuff with them. It's not gone. I mean, because this isn't a conscious thing. It's a subconscious underlying dysfunction in the central nervous system that can create amplified perceptions of pain, amplified perceptions of worry and anxiety. And I think what it does more than anything is it makes people always on guard to the point that they never go into stage 3 and 4 sleep, and they never
Wow.
truly rest. They never get restored. So often when you talk to them, again, doing a history, how do you sleep? I have a hard time getting to sleep because my mind's always racing. But then
Yep.
once I get to sleep, some of them, they get up every 4 hours and they can't get back to sleep. But some of them, will say, well, I can sleep for 12 hours, but I get up and I feel like I never slept.
Mhm.
Because it's not just the time sleeping, it's, going through the cycles of sleep, as we know. And you got to get into that restorative sleep to rejuvenate, to have your body repair itself and your mind to rest enough and repair itself to confront another day, right? And deal with normal stressors. So all of those things are really hard to unwind. And if you don't even ask about them, and you never consider them, and all you're trying to do is attach a symptom to a pharmaceutical and get out of the treatment room in 3 minutes because you got 30 more patients waiting, and you're only going to get paid so much from the insurance company for the ICD-10 code you're going to use. You don't have time to do any of that, right? I mean, the average office face-to-face time with the doctor in ambulatory environments across all provider types in the US as of a couple of years ago, and the last time I looked at this data was 6 minutes. 6 minutes. So
That hurt.
how do you deal with anything of any complexity in 6 minutes?
Well, Dr. Brady, you have to remember, we had you fill out all those forms in the portal.
Yes. Well, and there's another thing. All right, don't get me started. You fill out all these forms on your portal, or you used to do it or usually
Yeah.
you do it on the portal. They want
Yeah.
you to come to the office 20 minutes early. They make you
And have
actually
you do
fill
it
it out by
again.
hand, right? And then when you get back into the treatment room, the nurse asks you all the same
All the
questions,
same
right?
questions. Oh, it makes me crazy.
Sometimes I could see if you're going into surgery, it's a double, triple check, it's
Yeah.
making sure, but a lot of it's just disjointedness. You know what I
Yeah.
mean?
It
Like,
really is.
it's
All
crazy.
right, so you are speaking, like literally speaking the language of the majority of the women who are listening and watching this, who I deal with in health coaching, who have these complex history of trauma, of things that happened in their youth or childhood, or even more recently, that are absolutely impacting them now. However, I hear a lot of well, what can I do? There's nothing I can do. So where's the hope? What do we do? What are my steps?
Yeah, well, it really depends on the person, the history, their personalities and many other things. But there are a lot of different things in the bag of tricks, right? To try to
Hmm.
deal with that. But what's not going to fix what we just talked about is a magic pill.
Yeah.
I don't care if it's an herb. I don't care if it's a vitamin. I don't care if it's a drug. I don't care what it is. The solution is not in a pill, right?
Hmm.
Now, various pills can help. I mean, different nutrients can help, herbals can help, calming herbs can help. Sometimes medications can help, but they're kind of helping along the way. They're involved in the whole process, but they're very rarely the core element that, you don't have all your problems because you have a genetic deficiency of Prozac, as people say, right? I mean,
Yeah.
that's not the root of the problem. So sometimes the root of the problems are very deep and they're not easy to fix, right? So sometimes you have to work with someone, whether it's a counselor, a mental health person, or something. If they really understand trauma, they understand PTSD, they understand that, because not all of them do, right? I think the modern trained health coaches generally do. I think they get that as part of their kind of training. And that's where I find them extremely valuable, because they can actually spend the time with the person and they can form that bond. The person who's in that scenario, they don't need cold clinical immediate solutions. They need some coaching. So it's a good name, health coach, right?
Yeah.
They really need coaching. They need some humanity involved in someone helping them get better, pointing them in the right direction and guiding them, holding them accountable, things like that. But, a lot of it involves different things that we know can calm the nervous system down. And a lot of these aren't new. They come to us from old traditional forms of, healthcare and old cultures, whether it's, things like meditation, things like, more calming types of yoga practices or Tai Chi, or it could be even something as easy as deep breathing or guided imagery. There's, prayer. There's so many different ways that you can go about this as a daily practice. And that's the key. It has to be a routinized daily thing that you commit to, because no matter what practice you do, you're not going to erase 30 years of stress and damage, right? Of imprinted stuff. You have to start training your brain to go about things in a different way and to react to things in a different way. And the way I try to explain it to patients is, listen, when I have you do meditation or you do deep breathing or whatever we thought would work best for them, right? Could be prayer, it could be, it depends on their belief system, depends on their personality. What we have you do, you may not think that this is very powerful, right? You may think, oh, what's this going to do? And you know what? Doing it one day, probably not going to do much. But when you do it every day and you take that time for yourself and you calm down, you put away the phone, you get rid of all the external things that you think you have to do, and the world will end if you don't go through your list every day, right? You have to extract from that and you have to turn inward and you have to calm your mind down. It's a rejuvenating thing that's a daily practice, because you don't have to reset your entire history of stress. When it becomes a practice, all you need to do is tuck away the stress from that day, right?
Mhm.
And you do that every day, you don't get this mountain, this stair step of stress that pulls you down, right? So, and if it's past stress and trauma that can't be resolved, there's different schools of thought on that, right? There's different ways to approach that. There's that school that's a little bit, not as popular right now, is you got to go relive it. You got to process it. You got to dig it back up and go through it and almost live it again and reframe it and go on. I'm sure that's worked for some people. I think sometimes in some people, it's just another trauma.
Yeah, it's traumatizing.
In some people, I've had them, maybe a traumatic thing with a parent or a family member who's older now. They're different. They've reconciled. They've actually confronted it. They've reconciled. They've come to a new peace. They've forgiven, and kind of forgiveness therapy, if you will, and they've been able to reframe it and move on. Other people don't have that option or aren't willing to do that. There are really good sort of brain reset, brain retraining programs out there that people can even engage in on, sometimes in groups, sometimes in individual therapy or counseling with people who are really good at doing it. I have a couple of people who are good at doing that, and it's been very, very successful. And I've actually had a couple of patients that had such great results, they were motivated to go learn how to do that as the provider to
Hmm.
help other people, right? So it's just this sort of brain reset trauma kind of processing, and it can be very helpful. It's totally outside my skill set, right? So you need a team. You do need a team of people that can help you do this. So you need health coaches. You need people who really understand, trauma, even at the level of a psychologist or higher. And you need just other people who can handle different parts of the cases with different, really complex people.
All of this that we're talking about sounds a lot harder than taking a pill.
It is.
And I think and that pill is often covered by insurance.
That's a whole nother
That's the
thing of framing.
problem.
It's framing it in
Yeah.
people's mind. And again, I'll go back to it. It's somewhat generational. The older people are, the more I think they're a product of those years in the, let's say, the 50s, 60s, and 70s, when the culture was really kind of ingrained with this idea that, your insurance should cover all your
Yeah.
healthcare needs. It does not. I mean, I think anyone, with any sense of reality knows that your health insurance should be considered catastrophic care. If you have
Yeah.
to go in the hospital, if you need surgery, if you need something like that, and the bills would be astronomical, you have some insurance coverage there, Bridget, and help you for kind of nuts and bolts prescriptions and stuff. If you have that kind of coverage, great. But if you think your insurance is ever going to cover your proactive wellness care, whether it's under a national healthcare system or a private healthcare system like ours, because neither provide this at all. I think people are of younger generations, I think have reconciled that they have to invest in their health and wellness just like they do other things that they like to do or want or value. And that means sometimes having to spend some of your disposable income on a better diet, on better food, on a lab test to find out what's going on with you, on the right kind of supplements or whatever it may be, or gym membership, whatever it is, it's not going to be free because virtually, nothing like that of high value generally is free.
Yeah. I heard the latest I don't know why I can't say that word today, that I heard was that on average in the United States, like smack dab in the middle,
Yeah.
women are spending $3,000 kind of extra over and above on things like supplements and out of pocket, not related to insurance, to further their health, which is actually reassuring to me because that means some are spending 3,000, some are spending 15,000,
Yeah.
and I feel like that number is probably going up and up. So to the woman, to the man out there who knows that they might have one of these chronic complex conditions and that they need to find somebody else, a functional medicine doctor, an integrative practitioner, somebody that can help them with all of this. And then they go into, okay, what are the tests that I should get done? Where's the best bang for our buck? Is it gut testing? Is it lab work every 6 months? Is it something else I'm not talking about? Talk to me about my options and what would be best.
Yeah, again, I wish the answers were always easy because that's
I
where a
know.
good doctor or a good clinician come in because they're going to triage what's the best bang for your buck based on your situation and your case, based on your background, based on your history, but based on your symptoms and your story, basically.
Mhm.
So for some people, absolutely, it's gut testing, particularly if their main complaints are around the gut and IBS type of stuff. They have diarrhea or they have constipation, they have bloating, they have gas, they're miserable because of their gut. I'm definitely going to do gut testing. I'm going to look at their microbiota or their microbiome. I'm going to look at their digestion and absorption function and their gut immunology and whether they have leaky gut or inflamed gut lining and barrier integrity issues. We're going to look at all of that stuff for sure. In other people, their guts, they don't really seem to have gut problems, but they have profound fatigue and they have a lot of mood issues and they have anxiety and they have increased pain perception and hypervigilance. I'm probably going to do something like an organic acids metabolomics type of test, right? Where I'm going to look at a lot of those key pathways of neurotransmitters, catecholamines and serotonin and cortisol and all these stress hormones. We're going to look at mitochondrial function in how they make energy aerobically and anaerobically. We're going to look at do they detox well, right? So all of that stuff we can get on urinary organic acids and or metabolomics testing if we want to go a little further than just organic acids. Oftentimes in chronically ill patients with a lot of problems, we're doing both of those things because they're answering different questions. Of course, we're always looking at standard labs because you first do have to rule out the big, the
Right.
acute stuff, right? So, I'm probably the most common test I order in my practice would still be a routine blood chemistry and a complete blood count and a full thyroid panel and inflammatory markers, CRP and sed rates and autoimmune rheumatoid factors and things like that because that's iron and ferritin and those are all nuts and bolts things. You got to fix those things, right? But that's like fixing, you got to make sure the foundation is at least semi solid, but then you got to go more into the individualized, nuanced things. And that's where blood work breaks down. I mean, blood work was really designed to really look for pretty significant outliers. I mean, what most people don't know is the standard ranges on routine medical blood testing. They're set on what's called a 95th reference interval. So it's like two standard deviations from a mean. So if you take a test, any test, the way they set the ranges is a lab, let's say it's Quest or LabCorp, or any big lab or even a smaller lab, they're going to look at, let's say, 1,000 samples that were run. What was the mean or let's say average value, right? And then they're going to do two standard deviations, a bell curve. And then they're going to do the low and the high cut at the second two standard deviation point. So they're called 95th reference intervals because by definition, the normal range will take in 95% of the population. So by definition, you have to be in the lowest 2.5% or the highest 2.5% to have an L or an H next to your result. Now, there are some exceptions to this, but generally that's the rule. So it's not meant in any way, shape, or form to find optimal function to look at are you really performing well or not. It's simply answering are you so far out of normal we have alarms going off. It's meant to look for people who are going to die basically in
Right.
in the beginning. Now it's evolved beyond that, but you don't want your referendum to just be, am I worse than 95% of people when you're looking at a lab test, right? And that's literally what it's doing.
Especially in a sick population, which I
Of
would
course.
argue that we are a sick population for the
Exactly.
most
We're not
part.
only a sick population, but they're setting the normal that they do this two standard deviations from on the people who get blood work done. Well,
Mhm.
people don't wake up in the morning and go, I feel so good today. I feel so energetic. I feel so on top of my game. I'm going to go have some blood drawn, right? No, it's inherently biased toward a not feeling great or a sick population, right? So it's meant to find, in its origins, it was meant to find organs failing and serious medical disorders, which it's good at. It can see if your liver's failing, if your kidneys are failing, things like that. If you're totally anemic or whatever it may be. But it was never meant to look at levels of function. So that's why in functional medicine, we got to turn to functional testing, which sometimes we use blood. And when we do, where it's appropriate, we often use different ranges. We use functional
Yes.
ranges, right? But you can't just take every blood test out there and squash the 95th reference interval toward the middle and say, you need to be here. And if you are, you're good, because they don't all work like that. It's just not a valid way of doing it. But in functional medicine testing, we're often going beyond that, and we're following biochemical path. We're not just looking at one marker. We're looking at a series of markers along a biochemical chain and trying to see, do you go from A to B? Fine. Okay. Do you go from B to C? Fine. Okay. Do you go from C to D? Fine. No, you don't, right? C is building up and there's not a lot of D. Okay. Well, what is that enzyme that makes C convert to D? And we can't change the enzyme right now because we can't change your genes and make you make more enzyme or a better structural enzyme. But we might be able to say, hey, that enzyme that's sort of a weak point in you requires B12 as a catalyst, right, to make it go. And if you're maybe you need more B12 than the average person
Mhm.
because you need to kick that enzyme hard, right? So that's just one little example out of my head. And there is such a test, and it's in even conventional medicine, although most doctors don't order it. It's called the methylmalonic acid test or an MMA test. We look at it every day, all day long on organic acid tests. It's our functional B12 marker. Because if you don't have enough B12 for your needs, not enough to be in the range on blood work for B12, but if you don't have enough for your cellular function, your methylmalonic acid will go up and it'll kick into your urine, and we find it on a urinary organic acid.
Can you tell people and, just quickly why B is so important? Why vitamin
Well, I
B12
just
is so
picked that
important?
out of my head, but of all of the vitamins, the B vitamins are the most involved in mammalian biochemistry as enzyme catalysts. So, like on an organic acid test, we have a whole panel of metabolites looking at reactions that are enzymatically dependent on B vitamins. So we have methylmalonic acid in B12. We have formoaminoglutamic acid or Phe-glu and folate. We have xanthoronate B6. We have all these different markers that we can tell, are you getting enough of whatever nutrient or mineral it may be? Because that's what vitamins and minerals do. They key enzymes, right? So the B vitamins are the most important. B12 just comes up in my head because we're looking at it a lot because we see a lot of people are fatigued. And a lot of
Mhm.
people, when they're fatigued, they take B12
More
shots,
B.
right? I mean,
Yeah.
there's a direct connection in B12 and energy metabolism, but there is with other B vitamins as well. The most common mineral in mammalian enzymatic catalyst activity is magnesium.
And that's all the rage these days, which I want to put a pin in that because I do want to talk about that for a second. But I want to go back. The way that I kind of look at it and explain it to people is like, remember those choose your own adventure books?
Mm-hmm.
We're like, okay, if you choose this, then you go here. That's kind of what your blood work should be if you're with a really good doctor who's digging into it. It's not that you're all in the middle and that you're within range. It's like, okay, if this level is here, then this level should really be here. And if that level is here, then this level should be here. Because we're all bio individual and we all have different bodies and different needs. So you can't just look at your blood work and say, oh, I'm down the middle, I'm fine.
No, and you can't even just look at your blood work. You got to look at your
You're right.
metabolomics. You got to look at,
Yeah.
because blood work is at one point in time when you stuck the needle in the arm. Something like timed urine out, timed organic acids or metabolomics are over an 8-hour period. Let's say it's things that are coming out. You could follow biochemical pathways. Then there's genomics and there's microbiomics and there's proteomics and glycomics. There's all these different things. You go different directions based on the case and the concern and the systems you're trying to evaluate. So you need someone who kind of has enough knowledge of all those things to know which direction to go. And it's not people, lay people, particularly when you see the way it's framed in social media these days, they think of lab testing as a binary yes or no answer. Like, I'm going to do this test and it's going to tell me yes or no if I have this or if I need this, right? That's really not the way it works that way in some lab
Some,
tests,
yeah.
but generally the gold is not in that. The gold and the real value is to be able to pattern analysis these labs and even use different ones in concert with one another and integrate them all and have that contextualize the whole case. And good doctors can do that to a certain degree. I've been doing this over 30, very involved in the lab industry and developing tests. I can look at things and often put a lot of pieces together. But anybody, me or anyone else, it gets overwhelming these days with the level of data, especially when you get into genomics and metabolomics. So that's where we're using machine learning and AI and all these new ways to be able to learn from metadata, from big data sets over large population groups, and then boil that down to the individual and take those lessons and mine for those, computationally using computers. That's the big change in functional personalized medicine. But it's also the dangerous change because, you also can't just send in a sample, have the computer chew it all up and send you a bunch of stuff and you're miraculously going to improve your health. It's failed miserably to this point. All of these direct to consumer tests that you see pitched to you on Instagram and Facebook, they've been around forever. You'll send in your sample, you'll get this app and this crazy website, you'll have all these million things being told you. You don't know what to make of it. It's really hard to action. You have no one there to help you, no one to hold you accountable, no one who really understands how to extract the most impactful lifestyle or dietary or supplement change out of that. And they generally have been failures in the market space because of that. It's not that easy. There still needs to be, in my opinion, that knowledgeable human touch to help you with it. You can harness
Yeah.
the great information from that stuff, but it's not as easy as plug and play. Maybe someday it
Yeah.
will be, but I'm not sure it ever will be.
Which is part of the reason why, and Dr. Brady is with Designs for Health, and that's actually who I use too when I do any type of functional testing with my clients and I'm a big fan of the GI Spotlight, which is the poop test. I feel like we get a lot of information from that. And I do appreciate that, I then get a chance to talk to a practitioner who goes through it. And what I think I love the most is that there's always, sure, these are the supplements that you can take to get rid of the bad guys, to increase the good guys, to shore up the leaky gut. But here are the diet and lifestyle changes that need to be made. Like we said in the beginning, Designs for Health does testing and supplements. They can't make you go for a walk. They can't make you eat whole foods from quality
No,
soil.
no.
But they understand that honestly, nothing's going to work in even the supplement space if you're not addressing the lifestyle changes.
Yeah, and we try to provide information along those lifestyle changes and things with the test results, let's say, but you really need the practitioner involved. That's why
Yeah.
we don't do any direct to consumer. It's got to have a practitioner in the equation that really understands how to work with the people to get the best bang for the buck out of it. Because even no matter how you write the algorithms or the interpretation in the background by the computers, right?
Mm-hmm.
It'll give you a series of suggestions or ideas. But in a really complex, chronically ill person, they honestly have so many problems often that you'll get a list that's too long to ever action at one point. So that's where the clinician working with the person has a better idea and a context over the whole case, knowing the person and knowing how they work to be able to then decide this is the order we're going to do it in, or we're going to do this and this, but we're not going to do this for now.
Right.
Because you
Because
can't
oftentimes you
overwhelm
just get
people.
too. I was going to say you can't get overwhelmed.
Yep.
It's got to be baby steps. It's got to be
Right.
small steps, and I do find that a lot with some of the testing where there's like, okay, there's phase 1, phase 2, and phase 3, and here's what you should do. Do this 8 weeks, 4 weeks, take this, and I'm like, okay, we're just going to start with digestimes. Like we're just going to start with one thing because getting overwhelmed kind of adds to the anxiety and the brain fog that many of these people are already feeling.
Correct. Yep. Yep.
Do you have, and again, understanding that you should be working with somebody, but do you have supplements that are your favorites these days that you feel like, or maybe that you take that you feel like are super, super important?
Yeah, of course. Let's see.
There they are.
Yeah, I mean, or a lot of times people ask me that, like, what's your desert island supplement? Like if
Yeah, that's a good
you're
one.
stranded, what would be the one you would have? That's always a difficult question, actually. But yeah, I mean, I can tell you what I take daily. I take I am still in the multivitamin camp in that I think a good, well-designed multivitamin with
Interesting.
activated Bs, phosphorylated Bs, methylfolate, not crappy over the counter one a day multis with cyanocobalamin and synthetic folic acid and D-alpha tocopherol. No, a really well designed one. So I do a multi. I take
But let me
vitamin D.
stop there for 2 seconds. Let me ask
Yeah.
you my follow-up question to that then.
Yeah.
With a multi, I think in the past I always thought, well, you're not getting enough of each thing in there. But you think with a good, well-designed one, you can get enough.
You can, but you got to always remember supplements are called supplements for a reason. They're
Yeah,
supplementing a good diet, right? So it starts with
right.
the diet and starts with food. But just having a good baseline multi, I know how valuable that is because I do a lot of testing and I see how people have different needs along pathways that involve a higher need for different nutrients that are often in a well designed multi. So they don't have to take a separate, folate or B12 or this or that. They're kind of covering like a foundational base with a good design multi. I take vitamin D every day. Um, and then I think for many,
What level do you vitamin D a week?
I take 5,000 IU's a day, but it's a
Okay.
vitamin D. It's not just vitamin D3. It's vitamin D with the right kind of K fractions
Okay.
and
Yeah.
ratios in it. So it has K1 and K2, MK4, all of that in it because that helps signal the vitamin D allows you to take up more calcium, and then that signals the calcium to go to the hard tissues like the bone and teeth, not to your blood vessels in the wrong place, right? So, but I live in Florida most of the year.
Mm,
you know I'm
lucky.
out in the sun a lot more than a lot of people, but even so I take 5,000. I need about 5,000 a day, even living in Florida 8 months of the year, to keep my levels at a what I think are a good, robust kind of optimal
Which is
place.
usually higher than what the recommendation is on your blood work, PS, and by the way.
Yeah.
Just
Yeah.
throwing that.
I'm not one of those people who think, you need to get vitamin D as high as you can and in the hundreds and things like that. I'm usually 50s, is sort of the goal for me. So I do that. But then, I'm not getting any younger and I'm very active. I had kids late. I was in school forever. So I got
Uh,
teenage boys and they're big, athletic, strong
God
kids and
bless
they
you.
make me do crazy things with them. So I try to take care of my joints a lot. So I do take a glucosamine, chondroitin sulfate and some collagen and, stuff like that to kind of keep my joints in the game. And I take some peptides. So I take our performance peptides, our Peptistrong to keep muscle mass on. As you get older, you really got to maintain muscle mass. So but
Mhm.
there's a lot of options on that, HMB and creatine and other things. There's a nutrient that I've been looking at and studying for a long time. Now it's not pervasively known out there, but it's got a funny little name called geraniol or
Hmm.
GG. We call it, and it's an endogenous compound that we all make internally, and it's a keystone compound in what's called isoprenoid biochemistry, and then it helps make all what we call prenylated proteins. So the proteins in your muscles and your hemoglobin. It is a precursor to coenzyme Q10. In vitamin K, it's just a keystone kind of thing. I do take that combined with a form. It's in the vitamin E family, but it's not normal run of the mill vitamin E that you get in supplements over the counter at GNC, which is D-alpha tocopherol, which you don't want to take alone unopposed. This is called delta tocotrienols, and it's extracted from the annatto plant, but it's got unbelievable data on cellular robustness as you age. It's got, even though we can't, make that treatment claim or anything, it's got tremendous clinical trial data on a whole host of different disorders from non-alcoholic fatty liver disease to different forms of cancer, believe it or not. So
Wow.
that's kind of an anti-aging, keep yourself healthy hedge. Is I take this combo of annatto tocotrienols with that GG compound. So that's a new one for maybe people to do a little research on and look up. I do take some S-acetyl glutathione with N-acetylcysteine just as a detox, just because of our exposome and environment
Hmm.
we talked about. And let's see what else. If I'm feeling like dragging or fatigued, I will often, use some CoQ10, some nicotinamide riboside, some kind of mitochondrial nutrients. And then I do take stuff before I work out to get the best bang out of my buck for maintaining and or hopefully putting on some muscle mass. So I mentioned some of those things before.
And to that point, what are your non-negotiable health practices, real quickly?
Oh, non-negotiable. That makes it sound so rigid, like I never missed the
Well,
mark.
okay.
Yeah, because I'm not that perfect, right? So I really think the three most important things to your health that I can just kind of tease out and extract are you got to sleep, right? So I have so many
100%.
patients who can't sleep. They just don't sleep well. They can't get to sleep. They can't stay asleep. They're unrefreshed sleep. So we really work on their sleep. There's a lot of things we can do with sleep, although, some people it's really, really hard. And so good sleep, paying attention to your sleep, trying to get regular sleep, paying attention to the circadian rhythm and light cycles, right? Being being in a very dark room, a quiet room, a good sleep environment, not being disturbed through your sleep. When you get up in the morning, get out in the sunlight if you can and move before you eat, even. And when you do eat, the first thing should not be the typical American sugar or some form of simple carbohydrate with a stimulant in the form of caffeine. So that's just not going to get you there. So, in fact, I don't really even eat much of a breakfast. I don't eat until like 11 o'clock or so. So I do little bit of a later eating window, but that's not for everybody. Some people,
No,
might
very
feel
different.
feel better eating when they get up. But so sleep is a big one. Doing something to control your stress is another big one, right? Whatever that is for you. For me, a big part of it is getting outdoors. It's one of the reasons I made a conscious decision to move to a place where I'm not shut in all winter in the cold,
Yeah.
that I can have a very active lifestyle as I get older and keep moving. So I'm always out on my bike, or I'm out on trails, or I'm out in nature, or I'm on the beach, or I'm out on the boat. I'm doing something where I can experience nature, put my feet on it, and bare feet, and grounding and all those kind of things. They may sound silly, but I really think it connects us to our environment in a way that we've lost. So that's important. The other thing that as I've gotten older, it's become more important is just gratitude and chilling, man. You just gotta. I mean, I grew up in New
Love
Jersey.
it.
I'm an Irish guy from New Jersey. I mean, are you kidding me? My nervous system was cranked so high when I was young, and I was training in engineering and then medicine. And before that, I was a rock and roll musician. I mean, my adrenal glands, I'm surprised they survived, my 20s and 30s. But, as I've gotten older, really, I think come to grips with you gotta not get worked up over everything. All the little stuff that we think matters doesn't matter, right?
Mm.
We'll be gone. It'll be gone. No one will even know what happened, right? So, and I'm not perfect on this. I often have to reset and go, man, why? Why am I worked up about this, right? This isn't important. Someone else's actions shouldn't dictate an unhealthy reaction on your part. That's your decision, right? But we're just reactors, right? So trying to get over that and trying to get out of that, like, immediately up into a defensive kind of sticking up for you. It's just in my DNA. I've had to really control that as I've gotten older and just try to get more emotionally intelligent about circumstances and situations. And certainly not perfect, but way better than I was. And part of that is gratitude, just being very thankful for what you have.
Yeah.
We're programmed to think we want the next thing, right? We need that. We need this. If I only had this, if I only had this house or this car or this boat, or if I only had this relationship or this whatever. And most of that is just fallacy.
Yeah.
Being thankful for being here. It's just so miraculous that we're here at this common time with one another and enjoying people around you. Really, I really love spending time with people I like. That's the biggest thing, most important thing to me now. And I guess it's just a natural thing. The older you get, the more time becomes precious, right? And the
So
little
true.
things really matter, and the stupid stuff doesn't. So that's big. And then the final thing is just trying to eat the best I can, just trying to eat
Yeah.
real, whole, fresh foods whenever possible. It's hard in the US to eat clean no matter how much you try. So you're not going to be perfect. But one of my old nutrition mentors said to me, 35 plus years ago, look at the plate when you're about to eat it and ask yourself a simple question. Could you have bought and or obtained in some way the food that you're eating in the form you're eating it 100 years ago? Now,
It's a
we
great
know even if
question.
you get all fresh stuff and stuff from fresh produce, it's not exactly like it was 100 years ago, right?
Nope.
But at least it's closer than stuff that came out of a can, a box, something that's totally fictitious food, as I call it. So try to eat whole, real, fresh food of various colors, enough lean protein, good quality fats, good quality carbs, and not the junky processed carbs. And I don't drink very much alcohol at all.
Good
I'm
one.
not like zero, but less and less and less the older I get.
Yeah, we always say, you know where your food grew or where it mooed,
Yeah. Yeah.
where it lived or roamed. And even though alcohol is a whole food sometimes, like you know it came from a cactus or a potato, we do know that really no amount is good for us because it is a poison. So it's going to mess up things like your sleep, which is one of those cornerstones.
Yeah.
Well,
Yep.
Dr. Brady, I am so grateful for you. Speaking of gratitude, where can people find you? We're going to link Designs for Health and all of that in the show notes. But is there any place specifically if they want to read more about you or learn more about you or
Sure.
anything that you're doing right now?
Yeah, probably my mothership would be just my main website is drdavidbrady.com. So Dr. David Brady, DRDAVIDBRADY,
There you go.
.com. So that has a lot of, my papers, interviews on various topics and different resources and how to get a hold of me and my practice if you should want. But also if for people particularly who may have fibromyalgia or think they do, or some global pain issues, my book, The Fibrofix, has its own website, just Fibrofix, FIBROFIX.com. There's a lot of resources and educational stuff on fibromyalgia on that site. And then, the Designs for Health website. And then also our lab, Diagnostic Solutions Laboratory, I think it's diagnosticsolutionsLab.com. That's where we do some really, really cutting edge diagnostic testing with a lot of the analytics behind it. So it's just interesting, cool stuff.
So great. Your
Yeah.
wealth of information. We're so grateful for you. Thank you for all you're doing in this space. And thank you for joining
Thank
us on
you.
StRest.
My pleasure. Thank you.
Wow. So how do you feel after that one? There was a lot of big words that he used. I know there was a lot of science, but he's an amazing doctor with over 30 years of experience. And I love that he could kind of talk to us about functional health and integrative medicine and what all that means. So a couple of things I want to tell you after that episode. First of all, Designs for Health is what I use for supplements because they are truly one of the only supplement brands that I trust. So you can find out more information about Designs for Health and all of those supplements in the links, also by working with me, because when you work with me, we're going to talk a lot about functional testing. I love the poop test, like I talked about, and some of the other tests that you can find at Designs for Health. So if you're at all interested in any of that, please grab some time with me. I have very minimal time for one-on-one coaching, but there is some spots available. So take a look or email me so we can discuss whether or not it's the right thing for you. You can also jump into some of my workshops. Those are a great place to learn more about the food piece and the movement piece. And then of course the stress piece, because we talk a lot about that. And all of those links are in the show notes as well. But I do think that it's time for us to have a big conversation about what it does mean to find a coach. I love what Dr. Brady said, that sometimes a coach is the best thing for you, even in addition to or in lieu of therapy, if you're dealing with some deep-seated childhood traumas. And that is something that I talk a lot about with the people that I talk to and with my clients. So in the next episode of StRest, we are going to talk about what it means to work with a health coach and how you know if it's going to be the right fit for you and whether or not you should work with me or somebody else and what kind of testing we do and what we look at. So the next episode of StRest will be me talking to you all about health coaching, and I can't wait to have you there. So don't forget, subscribe to this podcast and please share this podcast so we can help everybody be healthier, be happier, and be less stressed. Have a great one. God bless everybody. If you're enjoying the show, don't forget to subscribe and leave a review on your favorite podcast platform. Your reviews help others find the podcast and join our community. Follow me on social media at Kerstin.Lindquist for daily tips and inspiration. And visit my website at www.Kerstin-Lindquist.com to sign up for our newsletter and receive exclusive content. The information provided in this podcast is for informational and educational purposes only and should not be considered a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of your physician or other qualified health provider with any questions that you may have regarding a medical condition. The host of this podcast is a certified health coach and medical researcher, not a licensed medical professional, and the content shared does not constitute medical advice. While we strive to provide accurate and up-to-date information, we encourage you to do your own research and consult with your healthcare provider before making any changes to your healthcare treatment plans.